Hypotension, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Hypotension, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of hypotension. Chapter 1. 1. What is hypotension? Hypotension is a low blood pressure. 2. What is the normal range of hypotension? The normal range of hypotension is blood pressure below 90/60ths of a millimeter of mercury. 3. What does 90 represent in 90/60ths of a millimeter of mercury? 90 represents systole. 4. What does 60 represent in 90/60ths of a millimeter of mercury? 60 represents diastole. 5. What does mmHg represent? mmHg represents millimeter of mercury. 6. What is systole? Systole is the contraction of the heart. 7. What is diastole? Diastole is the relaxation of the heart. 8. Does hypotension always have symptoms? No, hypotension does not always have symptoms. 9. Can hypotension sometimes be dangerous? Yes, hypotension can sometimes be dangerous. 10. What are the signs and symptoms of hypotension? The signs and symptoms of hypotension include dizziness, fainting, fatigue, blurred vision, agitation, confusion, nausea, vomiting, cold skin, pale skin, etc. Chapter 2. 1. What is syncope? Syncope means fainting. 2. Can hypotension happen to everybody? Yes, hypotension can happen to everybody. 3. Does the body naturally try to compensate for hypotension? Yes, the body naturally tries to compensate for hypotension. 4. How does the body try to compensate for hypotension? The body tries to compensate for hypotension by increasing the heart rate or by vasoconstriction. 5. What is vasoconstriction? Vasoconstriction is the narrowing of blood vessels. 6. What are the causes of hypotension? Hypotension can be caused by low blood volume, orthostatic hypotension, tachycardia, bradycardia, very hot temperature, very cold temperature, blood pressure medications, arrhythmias, heart attacks, anaphylaxis, pulmonary embolism, dehydration, sepsis, a collapsed lung, alcohol, Parkinson's disease, etc. 7. What is orthostatic hypotension? Orthostatic hypotension is when there is a drop in blood pressure from lying down or from sitting to standing. 8. What is another name for orthostatic hypotension? Another name for orthostatic hypotension is postural hypotension. 9. Can orthostatic hypotension affect people of all ages? Yes, orthostatic hypotension can affect people of all ages. 10. What is Parkinson's disease? Parkinson's disease is a degenerative disorder of the central nervous system. Chapter 3. 1. What is arrhythmia? Arrhythmia is an irregular rhythm of the heart. 2. Can dehydration lead to low blood volume? Yes, dehydration can lead to low blood volume. 3. What is tachycardia? Tachycardia is a condition where the heart beats too fast. 4. What is bradycardia? Bradycardia is a condition where the heart beats too slow. 5. What is anaphylaxis? Anaphylaxis is a severe allergic reaction. 6. What is sepsis? Sepsis is a life-threatening condition caused by the body's response to an infection. 7. What is the function of the heart? The function of the heart is to pump blood to all parts of the body. 8. What is heart failure? Heart failure is when the heart can no longer pump blood effectively. 9. What is a heart attack? A heart attack is when the supply of blood to the heart is blocked. 10. What is pulmonary embolism? Pulmonary embolism is a blockage to an artery of the lung by a blood clot. 11. What is the optimal blood pressure? The optimal blood pressure is 120/80ths of a millimeter of mercury. Chapter 4. 1. What is blood pressure? Blood pressure is the force of the blood against the walls of the artery with each heartbeat. 2. What are the complications of hypotension? The complications of hypotension is that it can lead to falls which can cause fracture and injuries, also stroke, heart failure, shock, deep vein thrombosis, etc. 3. What is a shock? A shock is a life-threatening condition caused by the reduction of blood flow to the organs that causes the organs not to function properly. 4. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in a deep vein in the body. 5. What is neurally mediated hypotension? Neurally mediated hypotension is hypotension caused when a person stands for a long time. 6. Can hypoglycemia lead to low blood pressure? Yes, hypoglycemia can lead to low blood pressure. 7. What is hypoglycemia? Hypoglycemia is low blood sugar. 8. What is postprandial hypotension? Postprandial hypotension is hypotension that happens after eating. 9. Why can a person have hypotension after a large meal? A person may have hypotension after a large meal because a lot of blood go to the abdominal region in order to aid digestion. Chapter 5. 1. Is blood pressure equal throughout the day? No, blood pressure is not equal throughout the day. 2. When is blood pressure the lowest in a given day? Blood pressure is lowest during sleep. 3. Can caffeine help to increase blood pressure? Yes, caffeine can help to increase blood pressure. 4. Can thyroid problem cause low blood pressure? Yes, thyroid problem can cause low blood pressure. 5. Can corticosteroid help to increase blood pressure? Yes, corticosteroid can help to increase blood pressure. 6. Can beta blockers reduce blood pressure? Yes, beta blockers can reduce blood pressure. 7. Can calcium channel blockers reduce blood pressure? Yes, calcium channel blockers can reduce blood pressure. 8. How is hypotension diagnosed? Hypotension can be diagnosed by taking the blood pressure. 9. What are the treatment options for hypotension? The treatment's options for hypotension are drinking lots of fluids, reducing alcohol intake, compression socks, having regular physical exercise, avoiding lifting heavy objects, eating foods with salt, medications, etc. 10. What is the use of compression socks? Compression socks help to apply pressure to the legs, thereby moving blood upwards, which raises the blood pressure. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding hypotension.